people hear breathing or breath work's like a hot word right now, and that's be for better or worse. And it's kind of like the Wild West. There's no regulation to it, and anybody can take a weekend seminar for 2 hours and call themselves a breathwork instructor and lead breathwork. And so functional breathing, when I use that term, I kind of mean not a breathwork practice that you're going to go do for an hour or a half hour or 20 minutes. That's some kind of focused practice. By functional breathing, I mean, like, how do you breathe all the time? What is your breathing pattern like? Do your lungs expand? Does your diaphragm expand? And is it free to move? Are you breathing through your nose versus your mouth? Are you breathing? What's your breathing rate like? How does it sound? Those are functional breathing attributes or factors that I would look at, but it determines, oxygen delivery to the body. And I don't think there's any part of the body that does better with less oxygen delivery than more. And so one of the things to learn is that there's a big misconception with the gases of oxygen and carbon dioxide.